Wanted to welcome everyone to our ongoing series, Support and Connection, Person-Centered Practices during COVID. I work at the Center for Disability Studies at the University of Texas at Austin. I'm a mentor trainer with the learning community on person-centered practices. I want to let y'all know that this is a collaborative effort between the Center on Disability Studies at UT, Parent to Parent, which is a statewide parent support group and advocacy team of amazing folks, and also Money Follows the Person funding. And I have to also recognize the learning community on person-centered practices who have developed pieces of this, have developed a lot of the work that Randy will be sharing with you today. I wanted to let you know that Cinda is going to be dropping resources in the chat box, so be looking for that. The other thing I wanted to say is Randy will be back for part 2, and we'll talk a little bit about that on the 16th. You may have seen this on the promotion materials, but also we're really excited to have Shelby Davenport, who's a self-advocate and people planning together trainer, a person with a developmental disability. And she'll be speaking next week on the 14th and the 17th. We're also hoping and planning that our series will continue through the March 31st with different groups. And so we're trying to speak specifically to different groups of people that are at risk of COVID, an emergency. We'll be looking at folks that live in nursing facilities, state supported living centers, people who receive their supports and services in community, as well as foster kids. So we hope you tune into all of it and participate. I'll speak a little bit more to this, but the part 2 of this series for all of our speakers at this point will be a more informal session. We really need your questions on chat about what you're learning, what you would like to learn more about, because Randy will do an intro and a reminder of the one-page description. And then there's going to be an open forum of discussion about what people have learned, what works, what doesn't work. And we're hoping that you guys fill out your own one-page description throughout this week. So you may not know what that is. So I'm going to turn it over to Cinda real quickly and ask her, she's going to speak to a couple of technical things.
Welcome, everybody. We're really glad you're here. So we'll be utilizing the chat feature today. So if you have comments or thoughts throughout the presentation or questions, please put them in the chat box. We're asking that everybody keep their phone on mute. I will be, as Jeff said, I'll be putting resources in the chat box. I'll also put a link to where you can access these one-page documents that he'll be talking about, blank forms that you can utilize. So watch the chat box for those resources to come through as well. And with that, we're going to kick it off to Jeff. You can read Randy's bio, and we'll get started. Thank you, everybody, for being here.
Thank you. So I want to introduce Randy to you. Randy Consford has been married to his wife, Kathy, for 41 years and has 2 children and 2 grandchildren. He grew up in the mental health field as a child of a mom who struggled with a label of schizophrenia. He's currently writing a book about these adventures. He has a broad work background that includes serving as a United States Marine minister, hospital chaplain, and over 20 years in the community mental health field in both direct service, crisis planning, supervision, and various program director positions. He's currently the director of special projects for the Hill Country Community Mental Health and Developmental Disability Center, and is responsible for managing several projects. He coordinates Hill Country's disaster response services and is directing Hill Country's COVID-19 incident command. He's currently certified as an instructor for person-centered thinking with the learning community on person-centered practices, psychological first aid, and has a bachelor's and master's degree. So with that, Randy, you can take it away.
Well, thanks, Jeff, and thanks, Cinda, for getting everything all set up. And it's an honor to be here to talk with everyone. I'm just excited about it. But I want to get going because we don't have a lot of time. And I think we've got some interesting stuff to go on. Of course, these are all the folks we want to thank for helping us get this going. And so that's a great thing. I like to throw this slide out all the time, just because if we have any problems, we'll improvise, we'll adapt, and we'll figure out a way to overcome whatever problem pops up. This is kind of like my what's that word you say? My catchphrase that I use all the time. I even tell my granddaughter, and she says, when she has a problem, and she says, "Papa, I have a problem, but please don't tell me that improvise, adapt, and overcome thing." But so anyway, but I put it in there. We want to take just a quick little poll. Sorry to throw this on you so quick. And but we want to take a little poll, and it should just pop up. Are you going to do that, Cinda? And she's going to do it, and you just answer the questions real quick. There's just a couple. It's kind of fun that you can see. Is everybody got it? You go up to the top where it says poll, or is it just showing? There it goes. Now they're coming in. We got 59% no on the first question. 65. We've got 32% that have taken a PCT training. Still coming in. What do you think, Cinda? Is that enough time?
Hold on just a second. There's a couple more responses coming in. Okay, let's end it.
Okie doke. So we end the polling. So we had 54% of the folks have not attended a 12-hour person-centered thinking training before, and we have 27% that have. So some of this, for those that have taken the training before, will probably be familiar with some of this. The next question I was just curious about is how many of you know someone that has been positive with COVID, and 82% have said that they've had some experience, and I knew it was going to be pretty high. And then what best describes your status? And so we have 9% that receive mental health services. We have 64% that provide support. We have 36% that are family members and 9% others. And so thank y'all very much for doing that. Kind of helps give me a little context of how to go on some of the things that we do. So let's start off and talk a little bit about what is a one-pager, a one-page profile. And we'll talk just a little bit about that. What I want to do is show you a few just so that you can see how they work. A one page has 3 components to it. And in those components one is a positive introduction. So a way in which we can introduce. The second thing is what matters the most to the person. And the third is how to best support. So I want to just throw out, if somebody wants to jump on real quick, can somebody tell me what's important to Tyler? Anybody out there?
Dinosaurs.
Dinosaurs, right. I was thinking if I worked with Tyler, I'd have a couple of dinosaurs on my desk. Now this one page, and we're not going to go through all of these, but Tyler has problems with milk and some other things. And so his mom made this so that folks would understand maybe how to interact with Tyler just a little bit better. The point of this is that in each time that we do a one page, is we need a context to do it in. And so here's where that was for Tyler. This is Sam, and I'm just gonna throw this out there real quick. I love Sam because his family wrote this because he was going through cancer treatment. So the context was cancer treatment and how could he be treated while he's going through that treatment. One of the things that he loves is he loves beer, and he couldn't drink it, but I think his daughters found a way that they could make little beer slushes so that he could sip a little bit. And so that was helpful for him. That's a way they could support him. Karen, just real quick, is somebody who lost her partner. And I'm just going to highlight, in the context of something, losing a partner, she wanted folks to know, because everybody brings food, right? We all bring food to somebody that's lost, and she likes to cook and wants to get out and do that herself. So things that I don't need is for you to bring me food. So, it's helpful to know that. And this is how it illustrates a one-page description or a one-page profile can help us to understand how to support somebody a little bit better. This is my granddaughter. I had to throw this in there. Sorry, Jeff. But what's important to her is milk and unburnt food. If you burn the hot dog, she's not going to eat it. But the context of this was sometimes my granddaughter has some blow-ups. And then during those times, it's kind of awkward for everybody. So we did this to talk about what can we do to support you when you're feeling like you're going to blow up. And in this little blue part right here, she says, talk about it. And then, that's one of the things that she wants us to do. And she gave us some ideas. So this is just another example of how you can use a one-pager. And what we're going to work on, the context of what we want to work on is COVID-19 and the healthcare setting. And so we want to be able to provide basic health information and a focused one-page profile. And so we'll have some examples. The context, think about, I remember it's getting close to a year ago, it was in January, and I was up in North Carolina, Asheville, visiting my father-in-law, his family. And while we were up there, COVID started hitting, and his sister was in a nursing facility. And we had gotten up there and they said, you just got here, we're going to let you in, but we're going to start closing the facilities down so that no visitors can come. And we've had like a year since then, and we've heard stories of people that have been isolated. And we've heard stories about staff that are overwhelmed and are busy. And, they want to provide the best care, but the resources and the struggle is tremendous. And, it's nothing like I think any of us have experienced pretty much in our lifetimes, unless there's any of you been around that pandemic that was back in the 1800s. And y'all all look too young to be any of those folks. They're very interested in helping. We work some of our staff where I work are essential. And so they go out and provide services. It's scary. It provides anxiousness, so forth. Sometimes you don't have as much time as you usually have. So how do we help this healthcare setting be able to find information out about us and about our loved ones, friends, etc.? And that's kind of what we want to go through a little bit to talk about. Before you develop any of these things, there's 3 questions that you need to ask. Number one, where is the one page going to be used? That's the context we just talked about. Number 2 is, what do you want people to learn from reading the one page profile? All of us have different stories. And you ever notice that when I go home to visit family, I seem to revert back to the kid. Does that make sense? I'm a professional, I've had a lot of success in different things, but when I go back home, I'm just little Randy. And so, we have different contexts of what people know about us at work, at home. Everybody sees you a little different at different places that you are. And so in the one page profile, what do we want people to learn about me or my loved one as they read the one pager? Number 3, what do you want people to do with the learning? And so that's really important. Like the lady who said, when my partner died, I don't want somebody to bring me food. That's not what I want. And so this is a great opportunity for us to be able to share with others what we want, what we don't want in the supports that we receive. Remember, if no one reads it, if no one uses it, it was a wasted effort. So, it's really important for us to kind of get down to the things that are really important to us. And I just one of those, it's hard to do remote, but anybody got a quick question, or does it make sense? It's hard to tell if everybody's thumbs up. I saw thumbs up. Okay, everybody's going good. All right, we'll keep moving. This is an example of what we're wanting to produce. And we're going to go into more detail. And you can't see this too good. That's okay. I'm going to show a bigger one in just a second. But kind of what I want us to see is that we have a one-page document, one piece of paper. And on the front side will be a one-page that we have. And on the back side will be what we call the passport. It's a health passport. And it basically has basic information that's needed for healthcare providers to be able to help support you better, or our loved ones or friends. And so this is kind of what it looks like. And this is kind of the idea. Think about how powerful that would be, is if, you found out that you had COVID-19 and you already have this prepared, and you go to your doctor and you can share this with them, or, hope you don't have to go to the hospital. But if you go to the hospital, you've got this one page that you can give them that has a lot of your health information already there. And then it has these things about what's important to you, what people like and admire about you, and then how they can support you. And so this is what we're trying to come out with. This is the end result. This is the take home. And so you'd be able to hopefully do one for yourself. And I think somebody asked for a copy of the page, and we're going to have it some resources available for you in different forms. And Cinda, I'm going to have to ask your help real quick. I saw that question. Is this where they can get it online?
Yeah, so I'm working on getting the links in there right now to the website, where you'll have access to the one-page document and to the passport. And then there's a link to a sample one-page document. So if you want to share that with other people. So give me just a minute. I'm working on that right now.
Yeah, I shouldn't have done that. I should have gave you a couple more seconds.
You know what? It's okay.
But I saw that question. I thought that's a really good question.
I promise you, you may not see me, but I'm working behind the scenes. I promise.
Thank you so much. So here's a larger, and I want to introduce you to Elaine. And Elaine says, I'm liked and admired as a person that cares about my family and friends. And here's there's some things there that talk about. I like that the grandkids say she buys me things. That's a true grandma. But one of the things that she likes, can y'all tell what it is that she really likes? Roses. So she really likes roses, and so that's important to her. And she likes to have everybody admires the roses that are around her house. And then important to her, she says that. She says some other things like Diet Coke. If she goes to a restaurant and they don't have Diet Coke, she could leave. But if they have Diet Pepsi instead of Diet Coke, she's known to leave because she wants a Diet Coke. But just gonna pick on this one thing, the roses, because you can see the picture behind there, and you can see her picture with a rose. And how do we support someone like that? Well, one of the things that she wanted was to have roses in her room. If she had to go to the hospital, that would be very important for her to have some roses or pictures of roses in her room. Also pictures of her family, her friends, things like that, that's important to her. And so the idea of this is for us to be able to identify who we are, what's important to us, and then how can you support us? She likes color books, word search, keeps her busy, and she wants reassurance that her family's doing well. And so a healthcare provider can see this, and just very short little bit of information is able to maybe support her a little bit more because they know what she needs and what she wants. And so that's a real helpful, and I think it's a really powerful tool to be able to use for folks that we can put together. Now, this is the passport, and I got a couple examples of these. And I've taken that one page that you saw back here, this page right here, and I had to break it up for PowerPoint because to make it big enough for you to see, I had to break it up in several sections. But it's a passport, and here's Elaine, and then it has her personal information. So it has, her name, a nickname, if she has one, date of birth, date of her age, where she lives, email, if there was a legal representative, her insurance, her favorite pharmacy, also has her doctor and her specialty care doctor. And I'm sure you probably recognize that those are fake doctors, Dr. Flower, Dr. Tulip, just because she likes roses. Okay. But that's something she likes. Then it has current symptoms. So, related to COVID or a bunch of different symptoms that pop up. So if she, temperature over 100, feeling fatigue, shortness of breath, loss of smell or taste, so in this section, you could check all the things that apply to you or to somebody that you care for. And these are some of the things: headaches, low blood oxygen. She does have, she identifies that she has mental illness, and she's over 65. So this is some information that can help Elaine. Then it also have health conditions. She has high blood pressure, vertigo, and anxiety. And these are different medicines that she would take. So you'd have a list of that, and allergies. And then, you know, one of the real important things is, like, I don't know if you remember, but she did not, if she's dying, she doesn't want DNR. She doesn't want to be resuscitated. If she's not dying, then she says, bring me back. But if I'm going to die and be a vegetable, then I don't want to be brought back. So it's really important to know if she has a DNR, or do not resuscitate order. And one of the things that's happened a lot in the last few months with hospitalizations is people may have a DNR, but they can't find it. They don't know where it is. And so that creates a kind of an obstacle for our healthcare workers, because they don't know what they don't have a DNR, so they can't follow that. Here tells you where it's at. Like her husband keeps it in the safety deposit box at the bank. So it's written down there so that family can go get it really quick. Does the person have an advance directive? Yes. And the husband keeps it at the safety deposit box at the bank. And there is a psychiatric advance directive, but she doesn't have one of those. So this is just basic information that will be provided for folks. So let me show you. I want to introduce you to my mom. And my mom's a quiet woman. She never liked anybody noticing her. And she writes poems. She's intelligent, frugal, polite in every way. And she always likes to dress up. Something that she always wanted to do all the time. And she loves her sons. She's got 4 boys, so always wanted a girl. I was supposed to be the girl named Debbie, but I came out a boy, so I was named Randy. But anyway, she loves her boys, but she lost 2 of them to tragic accidents. One was run over at 7 years old by a car, and another one was burnt 90% of his body. And so, dealing with the label of schizophrenia, she would often be paranoid and scared that something else was going to happen to her sons. So she didn't show her love by hugging, and it took me a long time to understand this. She didn't show her love by hugging me. She showed it by calling me in the middle of the night and seeing if I'm still there. So she would call us. I would say, hello, who is this? And she would hang up on me. And I knew it was my mom. But that was the way, as time went on, I began to realize was her way of checking in on me. She didn't want to talk to me. She just wanted to know if I was okay. My mom carried what we the family started calling the nuclear football. The president carries the codes, and somebody nearby, an officer, will carry those codes to the nuclear bombs. And so they call it the nuclear football. And so my mom would always have to carry the nuclear football. It's a little bag that she made, and she would have all of her important papers in there. And if you tried to talk her out of it, you would have problems, because she's going to take it with her wherever she goes. She loves coffee, but she always did it in those old percolator pots. I don't know if y'all remember those. You had to pour the coffee in, you have to make it, everything like that. And I tried to buy her a Keurig once so that she could just brew the coffee, and she didn't want that at all. She didn't like that. My mom often gets scared of voices. She hears people that are trying to get into her business. She believes there's cameras and holes in the walls. Matter of fact, I went to a program called Marine Security Guard School. It's in the Marine Corps, where you guard and protect the embassies around the world. So I was in that training in a briefing. It was a top secret. It's not top secret anymore because it's back in the 70s. But they started telling us that they actually had these little bitty cameras. This is back in the 70s. They had these little bitty cameras that they could put in holes and watch and listen to what people were saying. And I remember sitting in that room when they told us that and said, you know what, my mom's been right all these years. They are watching and listening. But that's supposed to be humor, and I can't tell if you are laughing or not. But anyway, Mom was always good at managing her funds. And I do all this because, she was a person that would help other people. She was somebody that she would give money that she didn't have. And I used to get frustrated with her because I felt like, she sacrificed too much for other people and didn't take care of herself. And then my mom wanted to die on her own. When she was on her deathbed, she didn't want me to sit with her. She wanted me to leave the room. And I think she wanted me to leave the room because it was that moment of silence. that we learn to appreciate to each other, that she could leave and she could be assured that her pain would not be that my pain would not be as great as hers. And that was her sacrifice at the end. It was hard, but she didn't want me there. I want to tell you a little bit about my mom, because Jeff and I had decided that I could maybe write a one-page for her if she was still alive, and what it would look like, because she has some complex mental health needs. And so I just wanted to introduce you a little bit to her. And this is her page that I wrote for her. What's important to her is to know that her 2 surviving sons are okay. She needs to know they're okay. It's important to know that she believes that FBI is listening, watching in the holes in the walls. And so down here you see duct tape. In our family, when we have holes in the walls, we duct tape them so that she feels more comfortable that the FBI is not listening. So if she's in the hospital and you're supporting her and she's talking about duct tape, you need to understand that she's a pretty feisty woman, and she's going to cause you all kinds of trouble until you cover up some of those holes. It's important to keep her important papers near her. I don't know if you see down here, this is her case, her actual, what we call the nuclear football. She put flowers over the front, but inside that went everywhere she went. And so it would be important, and you could support her by making sure that her nuclear football was by her bed. So it's a little bit unique in some of the things that my mom would want that maybe other people would want, but you could support her by doing these things. It would be important to have a phone there, but not a cell phone. She didn't like cell phone. So the phone that's plugged in she will unplug it constantly, because she believes as it's plugged in that other people are listening. So she'll call somebody, and then as soon as she's done, she'll unplug it. Used to frustrate the hound out of me, because she would call and I'd call her right back, and it would be that tone. I'm sorry, but the phone that you called has been disconnected. And I know she's pulled that cord out because she didn't want anybody to listen. You know, the other thing that was really, really hard was my mom had bad experience with mental health treatment. When she was in the state hospital in Austin, before I was born, they did treatments on her, and they didn't ask her. You know, it was a day which you didn't get permission, you didn't ask. And they did treatments on her that scared her and kept her running away from the mental health services most all of her life. One time I got Employee of the Month at the MHDD place that I worked at, and she got services from, and they hung my picture on the wall, and she went in and saw that. And it took me about a year, because she said, they got you, they finally got you. In other words, she felt like the mental health services had gotten me. So it's really difficult to provide services. So she calls it back problems. And so it's important in here that we say, by understanding that the term back problems means all diseases, and probably really means her mental illness. So this just gives you an idea. I think this would be helpful for my mom. So we have a passport that goes through, and this is her name, all the information on there, her pharmacy, her doctor, and it also has, if she had symptoms with COVID-19, this is what they might be. I made these up. Some of it, she did have chronic bronchitis, which made it worse if she did have COVID, and checked her mental illness. If she saw this, she'd have a fit, but we had to check it. It also gives her health condition. She does, she has a do not resuscitate, and it's kept in her nuclear football. Remember the nuclear football? So if you want her do not resuscitate, you can go look there, and she has an advanced directive that was in there too. So this gives you an idea, another example of how this works. So Jeff said he thought it would be good for me to make one for me. So I up here at the top, I go, who to contact if if I get if I get positive with COVID-19, I had to go to hospital, then I can put my wife and my daughter. Those are the 2 people that are important to me that I would want you to call. What people like and admire. Here's some of the things. What's important to me. I like to feel busy, my family. I like to talk to other people, the Marine Corps, and music. And so how can you support me? Well, I have diabetes, so you can help me watch that. Let me play games, and then let me watch action movies, but I don't want to watch the fluffy stuff. So, and then I like coffee. this would be ways in which you could support me if I was hospitalized. Again, we have the passport, so it kind of has basic information about me. I didn't give you anything really significant here. I did put Dr. Gray and Dr. Izzy, and if any of y'all watch Gray's Anatomy, you might recognize those doctors. So I put them down as my doctors. Here's some of the things that could be symptoms that I could have, which would be helpful to check. And then, there I have diabetes. I do not have a resuscitate or advanced directive, shame on me, but this helps me to know that I probably need to work on that. I don't know, I hope you see that this is helpful, and this is just an example. How do you make one? Let's see, anyway, just looking at the things. How can I make a one-page profile? And so I want to show this a little bit. Here's like one that we use. It's just an example, and I think Cinda will have some this that you'll be able to get later on. And remember where it says what people like and admire about is that's where you want to have a positive introduction of the person. We spend too much time talking all the negative stuff. Let's talk about the positive stuff. My mom was always called that schizophrenic lady, but I always thought of her my mom. She fed me, took care of me, and tried to take care of me. So a positive introduction is a lot greater than a negative one. What's important? Well, what matters most to you or to somebody that you're working with, and what's important to that person. So here's where you can write it down. The nice thing on these, you can make them look real pretty with pictures like some of the ones we have on here, or you can just write these 3 things. What people like and admire, what's important, and then how to best support. And sometimes it's hard to think about those supports. And we write down the supports that best, that best would help us. But remember, these are always going to be in context of the COVID-19. Like if you were going to the doctor or hospital, or you needed to, for folks to understand what you need to support you in that situation. I pulled this out real quick, and what's going on with this man? Can I get somebody to give me cut your audio off and just tell me real quick what you think's going wrong with this, what's going on with this man? Can I give them Cinda?
I think they can unmute themselves.
Okay, if somebody want to unmute, just give me an idea. What's going on with this man?
Hard to tell.
It's hard to tell, but what do you think? Just
Confusion?
confusion. That's good. Good. Great. Anybody else?
Maybe he's having a conversation with one of his friends.
Yeah, it could be. Conversation with his friends.
I
A
think
couple more.
something.
I wanna hear
Somebody's-
your voices.
Somebody said stressed.
Stressed. Okay.
He's embracing someone.
I'm sorry. He's doing what?
He's embracing someone.
Embracing
maybe?
someone. Okay. And I show this to you because I think one of the things that happens is that when we work with other people, we make assumptions. And I set y'all up with this. That none of those things are what's going on. Oh, it could be what's going on with him. But here's the rest of the picture. This was in a newspaper article, I think a month or 2 ago. And it just, to me, made the hit home that we assume what they're going through. And then I'm gonna show you the rest of the story. Whoops. I have lost Joe, my lovely wife and soulmate. I have no friends or family, no one to talk to. I find the unremitting silence 24 hours a day unbearable torture. Can no one help me? And from this picture, we can't tell that. But I think his words help us to understand how we might support him. We might sit with him, we might talk with him. And so this is kind of the idea, in a sense. What can we write down that's most important to the person to help support them as they're going through this nasty thing called COVID-19? So let's get started. Go a little bit about helping you to make one. One of the things we really hope that you're going to be motivated to leave and make your own one page for COVID-19, or even some of your family. I've got my father-in-law's getting close to 90, and so we're thinking about doing one for him. He takes very careful, but we want to talk and look at that. So to get started, review the questions. Remember those questions before, and especially what's the context. And I did this before about showing him, because who knows the answers? And I think so often, I did a no by doing this one for my mom, but I couldn't do it with her because she's already gone. But you should always be doing it if you're helping someone else do, and don't just do one for them, but you should be sitting down with them. They know the answers to their life. They know what's important to them. It will be even surprising to us to find out sometimes that the things that we think are important to us and to loved ones is not important to them. My granddaughter, when we were talking about who are you closest to, and I'm thinking, she lives with me, and I'm going to be one of the closest people that she'll write down. And when we asked her who's the closest person, she named one of her friends at school, and I was heartbroken because she put me way down the list. And no, I know she really loves me, but sometimes, when asked with the question, who would you want to be around if you needed to do some fun stuff, she didn't want to be around Pawpaw. So that happens. So who knows the questions to all the questions? It's you if you're writing this for yourself, and it's the person whose profile that you're working on if you're helping somebody else, like a family member or somebody you work with. If others, who, there may be other people that can help you if the person can't do one on their own, like their family members, close friends, caregivers, who can tell you what others like and admire. So that, getting started, we're going to review these questions about, and especially focusing upon the individual and allowing them to have a say in their one page. So what do other people's like in mind? I always like to write it on a board, but you can do it on paper, stickies, anything like that. And a lot of times when I've done this with folks, they go, it's really hard to do this, to write about yourself. What do you like about yourself? What do you admire about yourself? What do you appreciate about yourself? And write it down. And so here we were loyal, tough. It's good to do like 1 word, 2 words, something like that. Don't write a whole, you can write a whole sentence later in your one pager, but just write some stuff down. What are you good at? What are you proud of? What's something that you've done that makes you so proud? What do people praise you for? What do people say are your good qualities? Write all of these things down. And so that's one of the first steps that you can take in trying to develop this one page. The second thing is what's important to you. And so like, who do you need to stay in contact with, and what's the best way to do that? Think about the loss with COVID is that so many people have had to go to the hospital or in nursing facilities. And I remember that one picture of I think it was the daughter who went to visit her dad and had to do it outside the nursing facility because of the glass window. Imagine, people are important to us, family members, somebody is usually always, is a close contact to all of us. What happens when that gets, with COVID, and you're made to separate from that individual? I know one grandma who said she is about 6 months, her grandbaby's 6 months old, and she's not held her grandbaby yet because of COVID. And, so what can we do? What do you need to stay in contact with? Can it be the phone calls? Now we've got Skype and other things that we can utilize, but some people don't know how to use those. So what would be your way, your method? What helps you feel better when you're sick or upset? When I'm sick or upset, I like my wife. I tell her, just reach over and touch me every now and then. I just want to know somebody's nearby. Sometimes when you feel sick, you don't want anybody to bother you. I kind of like somebody to bother me every now and then. I like that feeling. What helps you wind down, relax, or sleep? That would be maybe important to look at. List any spiritual practices. Many of us have spiritual faith, and so that may be important that we get to practice something that's important to us. What helps you feel valued and respected? So all of these things, and the value and respect is just so important, for us. What's important to you? List those things down, because the next step is how can we support you with those things? Again, it's in the context of COVID-19, but what does good support look like? Good support looks like how staff can help you feel less anxious or uncomfortable or calm or safe. You know, I think about coming into, you know, a hospital or something, and you know, it can be a very daunting. You know, you're anxious, you're not sure what's happening next. You know, and you know, sometimes it's nice for folks to be able to explain to you, and so to have it down there. Please let me know what's going on next. What's this treatment that you're going to do? You know, and maybe you have certain ways or of communicating, and you can tell the staff at the hospital, here's the best way to support me. Here's the best way to communicate with me. I like short, sweet answers. Be decisive, tell me we need to do this and let's do it now. You know, I like that. But some people, my wife doesn't like that. So she likes somebody to flower it a little bit and then kind of touch it all up, do all kinds of stuff, and then right at the end, tell her what it is that she needs to do. Outline how staff can help prepare you for the procedures, for the tests, changes. You know, some people say, just put the needle in, don't tell me. Some people want to talk about it a little bit. Explain how you might express pain. You know, some of us express pain in different ways. So that would be important. Include how you prefer to take medications. I don't like to take medications at night. I like to take all mine in the morning. I worked it out with my doctor because they wanted me to take like twice a day, but I didn't want to do that. I want to do it once in the morning, be done with it. So we found a way to do that. Include any physical or environmental accommodations you might need. You know, remember Elaine? Having some roses there would be helpful for her. Maybe a window. You like to look outside. I mean, whatever is important to you, this might be a way for you to identify that so folks would know. And describe any tips that might help staff help you. You know, anything that they can do that will help you out and make you know, your stay at the hospital a little bit better. And the more of this that we have worked out now, before, you know, I hope nobody has to go to the hospital with COVID or get treated for it or gets positive for it. But if you do, you're prepared and you're ready and you've got something that you can show and might be able to help you out a little bit. So after you've done all of this, you know, you've done this like and admire, and you've done, here's the things that are important to me, and here's the things that you can do to support me. The first step next is to kind of write your first draft. Take like look at the 4 or 5 most important things that you want folks to know about you. Use simple, plain language. The third thing is keep the statements brief, complete thoughts, you know, but you don't necessarily have to write complete sentences. Because if you make this so big, you know, the last step is you actually should probably be able to read it within a minute. And if it's longer than that, then, you know, healthcare workers, remember how stressed they are? Remember how busy they are? They're not going to read something that's got a lot on there. But if you've got some pictures and maybe some very, you know, succinct words that be able for them to look at really quickly and get it, will probably be more beneficial, that they'll probably use it. Next thing is to share. You know, good thing to always do. I write a lot. And one of the things that I find is I always make a mistake somewhere. So it's great to let somebody look it over with you so that you can look at it, get feedback. I did one of these and my wife looked at it and said, I don't understand what you're saying here. Matter of fact, I think Cindy, I'll pick on, I'm gonna throw them under the bus. Cinda and Jeff said, we don't know what this means. And so, but that helped me to be able to realize I've got to explain this a little bit better. I don't know if I did, but I worked on it. You might want to add, you know, we're talking with somebody and they say, you know, you forgot this. You're really, you know, you're really this. And so we can add to it, but still don't make it too long. Pictures are great, you know, to put in there. Include the health passport. We want to make sure that passport's on the back because that has just so much significant information that's helpful. And then you print it off. And you know what? You can change this. You can change, you know, next week you think of something, you can make a new one. That's the nice thing about computers, or just write on it. This thing can continue to be changed as time goes on. And so that makes it powerful and useful. Some tips, and then I was hoping to save a few minutes to let y'all do a few questions as I'm almost done. Tips is print it so that the one page has front and back. You know, some of y'all know you gotta, that those printers can be tricky and they may print it on 2 or 3 pages but get the setting where it prints front and back. One of the things that's I think is really nice is you can get it laminated, or if you have plastic sleeves to put it in. If you're in the hospital, it would be good to post it. Might be good to have a couple. You could post it like on that the little board there that they have where the nurse signs in. I think I would even ask if I would ask, see if they let me tape it on the front door. If people walk by, they can, and I might even put, I'm thinking I might put in there, hey, if you want to talk, come on in if they would let me. But I don't know if they would let them. That would be great. Make sure it moves with the person, so if the person moves different places, it goes with them. Ask the person who helps improve the one-page description by asking the person who helps the best and why. And so those are just some of the tips that you can use and would be helpful and I think beneficial. Again, this is our one-page profile. What we're trying to get, the important two, what you like and admire, and the how to support, and then that passport on the backside. And so that's kind of what we want to kind of get. And so I'd like to open it up to some questions. I don't know, Cinda, I couldn't see all the ones that came through while I was presenting. Is there a couple maybe that you could ask, that you could read to me?
One person said, it's interesting our high school alerted parents that many high schoolers are struggling mightily as the first term ends. I wonder if it might be a helpful activity for them to reflect on their strengths and to ask for help.
Yeah, again, see, I think the one page, we're focusing mainly on COVID here, but it could be very specific to school. I think we use this a little bit for my granddaughter so that folks would understand some of her behaviors and how they can help and support her. And so I think with all the struggles that are going on in schools related to COVID and other things, these would be very great. It'd be a great tool. Good idea.
Mm-hmm. One is, I can imagine for my son, it would be critical to know about specific things or strategies that might help him get out of a fit. So, right. So if you're being separated from your loved one, my daughter has autism, and behavior is a form of communication for her. So nobody's going to know how to support her unless I tell them, these are some things that can help her. So I think it's important. And I just want to say, I think it's important that we all have this. Encourage people that we're working with to do this, because we don't know what's happening, and we've heard horror stories about people who are in maybe nursing homes or some sort of institutionalized setting. They would write information on them to tell the medical professionals. Let's plan ahead and try to have an actual document that will better suit that. So that's one thing we've heard. Let me look down here some more. Could you share tips, suggestions on the follow-up and making changes to plan? Is there a family member who typically supports, or a staff support person?
Well, I mean, that depends, I think, a lot on the individual. I think it works best that I call it getting as close to that individual as possible. So the individual making their own, like I made my own. Elaine was somebody you would sit down and we gathered the information to, and then showed it back to her. And, she crossed some stuff off, changed some stuff, didn't like it. And that's kind of what we want to do. And there may be some that needs more support to be able to create that. And so we would find that support. I don't know if I'm answering your question real well, but I think that there are ways to do that. And it depends on the individual and what their support needs are.
And then Cynthia said, modeling is such a great way to teach. Do yours while you're helping someone else do theirs, which is true. So can you talk a little bit about, we are not, sorry, this just came up. We are not able to do CEUs for this particular series. Perhaps in the future ones we will be able to, but not in this one. Talk a little bit about what you want to see happen in the session next week. So we have a few minutes. So can you kind of talk about what that might look like?
We would love to see a lot of y'all come back. And then during this time, is maybe create your own or work on creating your own one page with the one page on one side and the passport on the back. Because one of the things is practice, and actually I think doing it is so very important. So we'd love to see you do that. And, we would love to be a lot more interactive next week is it next week? Yeah.
Yes.
And we would come back, maybe if some of y'all wanted to share yours and we could look at some of them, because it always amazes me how creative people can get. And if it's hand drawn, I think that's beautiful. Or if you get real fancy and make a real fancy one, that's fine too. But we'd like to do that. And then we would like to, one of the things that we do in person-centered thinking practices is we talk about what's working, what's not working. So what worked with you as you did that? Because this helps us, is this the first training that we've actually done to try to do this? I think it is. So,
Yes.
so it would be helpful for y'all and that you practice it, put it into practice, and then come back and tell us maybe there was a step we missed, or how we could better teach, or what worked well, it worked really well for you and you found it easy to do, or you didn't. Those kinds of things would be real helpful. And then to ask questions, and maybe we talk a little bit about this and the next steps and how we can utilize it, and how we can, and maybe some of you might have gotten to use it during that time frame, and you could tell us how that worked.
The other thing is the information, we do want you to share it. We want this information to go out to as many people as we can, because we think it's important. So share away, get other people to come back to the sessions. If we have new people, we hope to have new people next week as well. We'll do kind of a brief overview of what the one-page document is, but we really want to get feedback on, are there barriers, or was it easy to put together and you can see using it for people that you work with? Have you created one for your entire family now, right? Like, we really want this information to get out there. So share away.
Yeah, I think we have a poll that we want to take real quick. Let's do that again. And then we'll see how much time. Oh, I'd like to switch to the.
Oh, are you doing it? Sorry.
Yeah, I'm sorry. I've got that old habit with Jeff of just taking over. Did it go out, or have you got it?
Yep, it's out.
Yeah, if you could take this real quick, and then we got a couple minutes, we could ask a couple of questions.
And while people are doing the poll, there will be a recording available. It won't be available until after next week's session, but we will clean up the recording, and it will be on the UT Disability Studies website, and it'll be on the Texas Parent to Parent website. So just watch those websites. We'll be getting those out as soon as we can. How's it going here?
Yeah, and I want to just get this in, so we could ask a question, but while we're doing this, thanks to Jeff, and thanks to Cinda, and thanks to all of you guys for showing up. It was I hope this was helpful, and I hope it gives you some ideas on how you can make some of these yourself. We're getting up to 73%.
And
just so y'all know, we've got little holes in each of your houses or wherever you're at, and we know who doesn't fill out the poll. We've got little camera devices, and unless you've got them taped up like my mom did, but we know who's not completing it. 75%. I'm known to skew the polls by pressuring people to take it, but
note taken. If you come, be ready.
And does anybody have a question that you can come on, unmute, and we got like a couple of minutes left.
I have a question.
Sure. Is it Glenda? Glendy?
Yes, it's Glendy. Thank you.
Glendy.
Hi, thanks for letting me unmute very quickly. And it's kind of a two-part question, so that's why I didn't put in the chat. As a young and relatively healthy person, I understand that I come from a place of privilege. And so like when I am making like a regular doctor's appointment, there's not much to say about myself. But if I did want to share a one pager with a doctor, when would be like an appropriate time to send it? Should I do it like before an appointment, during an appointment? I also work with folks who are in chronic pain and going through physical therapy, and they're oftentimes feeling dismissed. And so I think it would be really helpful for them to have this kind of resource. So when is a good time because I have so many doctors, right? When would be a good time for someone like that to share this information?
My opinion is I don't know if there's necessarily a bad time.
Okay.
Whatever works best and what you like to do. I think it will surprise some doctors, but I've had a few examples of folks who've. I know we know a story of one doctor that didn't want to look at it. They mailed it to him and didn't want to look at it and didn't look at it, while another doctor did, and it really helped them at being able to treat that person. And it may be a multi-approach. Some doctors may be receptive, some don't. You may send it to them, and then you may come at your next appointment. So I don't know if you saw this, but I wanted you to look at this because it tells you a little bit about who I am.
Okay, so it might be appropriate to like send it before. It wouldn't be inappropriate to send it or email it, fax it, whatever, to the clinic beforehand and then follow up during the appointment.
I think so. I think though it's just like the problem. I ran a clinic years ago, and things come in through the fax and so forth, and it gets put to the side, and so nobody that's supposed to see it really sees it. They may not, depends on the clinic, but also taking one where you can actually put it in their hand, I think is helpful too.
Okay, thank you. And then my follow-up question to that was, do clinics or hospitals, are they able to, or is it considered best practice to keep this in their records or files?
I think in some place it is. We like to keep it in our files, but I worked at a mental health clinic. They can put it in there. They probably have their own rules, policies related to that. And so I imagine some may be different. It could be an issue, but I think it's a real powerful thing if they kept it in your chart and was able to look at it. And, when you update it, you could bring it in and update it for them. And that's just kind of a partnership, I think, maybe a dialogue that you have with your, your medical staff. So, and tell them, this is important to me. And I would love to have it filed. The thing is, if we don't ask, we don't know. Again, I can't speak for all doctors and their offices because I don't know. They may have certain rules, but I got a feeling that most would be pretty open to it. You do have the electronic medical records now. A lot of places have, and they're able to scan that in that. And I've gone to a couple of doctors' offices where I told Jeff about this once. They had a form that looked like the OnePage, what you like and admire, and they had created it for kids so that you could fill it out and color it. And it was a pretty cool little document. So I think some places are more, open to it. Good questions, Glendy.
Thank you. Thanks for answering.
Okay, we've ended the poll. So here's your results from the poll.
Okay.
Everybody's saying thank you. Great presentation. Again, we hope that you guys have found this helpful. It seems like most people responded that it was helpful. I did put an evaluation link in the chat box if you guys don't mind filling that out. We will also follow it up with an email with the link if you didn't get to it here. We hope to see you back next week. Monday the 14th is Shelby Davenport. And then Wednesday will be Randy's follow-up, and then Shelby will do her second follow-up on the 17th. So we'll be back at it next week. So we hope that you guys can join us. Please share with everybody. And I think that's it. Randy, I can't talk. Randy, thank you for a great presentation.
Thank you.
Thank you, everybody.
Thanks
Everybody
so much,
have a good day.
for
We hope to see
attending.
you again soon.
Yes. Hope to see you next week. Thank you, everyone.